The topic of my presentation is post-operative biological complications in implant dentistry. Are they predictable? You know that nowadays dental implants are a reliable solution to replace missing teeth and to reestablish function and aesthetics. And long-term clinical trials have demonstrated a success rate greater than 95%, which means that the remaining percentage of about 5% is considered as failures that we call, in a nicer way, complications. The objectives of this presentation is to analyze different clinical situations to determine the risk factors for complications, to examine the existing evidence between risk factors and etiology of the disease, and to try to come up with some conclusions based on the clinical observation and the literature. By definition, and according to the ITI Treatment Guide, Volume 8, a complication in implant dentistry is a problem that occurs following successful osseointegration with the implant in function. It begins with an inflammation of the gingival margin around the implant. It is called mucositis. And in advanced stage, if we have bone loss around our implant, it is called Peri Implantitis. And if it's not treated, it will lead to the complete loss of the implant and the explantation. So the Peri Implantitis is a disease with a progressive bone loss. It can be due to bacterial and dental plaque involvement. These are two examples of very aggressive bacteria found also in the periodontitis. It can be as a result of hardware complication, meaning that the prosthetic components or the cement is involved, and they can be related to general oral pathology. The most important one for us is the medication-related osteonecrosis of the jaws.